Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Mohs Surgery on nose and post-op reconstruction. Non-melanoma skin cancer is the most common type of cancer in the United States, and one of the most common sites where it develops is on the nose. Mohs Surgery often treats skin cancers on the nose. /r/n/r/n This procedure removes small amounts of skin and cancer layer by layer to limit the amount of healthy tissue that needs removing. Mohs Surgery can treat basal cell carcinoma, BCC, squamous cell carcinoma, SCC, and other types of skin cancer. /r/n/r/n Although this surgery minimizes tissue removal, scarring is still likely to occur, and some people may need more extensive reconstructive surgery for the best cosmetic and functional outcome. This article will review Mohs surgery on the nose and options for postsurgical reconstruction. /r/n/r/n This photo contains content that some people may find graphic or disturbing. /r/n/r/n Reproduced with permission from DermNet dermnetnzorg 2023. /r/n/r/n Mohs surgery can treat skin cancer in areas where keeping healthy tissue is important, such as on the nose. Traditional surgical excision methods usually remove larger amounts of tissue around the cancer, but Mohs removes the cancerous tissue layer by layer. /r/n/r/n Each layer is immediately examined under a microscope to ensure that all cancer cells are removed while leaving as much healthy tissue as possible. /r/n/r/n Most often, the purpose of performing Mohs surgery is to cure someone of their skin cancer. Studies have shown that Mohs surgery can have an over 99% cure rate for BCC and SCC. The surgery allows for a cure and a likelihood of a better cosmetic and functional outcome than traditional surgery can. /r/n/r/n The most common skin cancers on the nose are BCC and SCC. BCC is the most common type. It usually occurs on sun-exposed areas of the skin, such as the nose. SCC is less common but may be more likely to grow into deeper areas of the skin than BCC is. /r/n/r/n Both types of cancer usually result from exposure to ultraviolet, UV, radiation from the sun or tanning beds. Other risk factors include /r/n/r/n Knowing the signs and symptoms of skin cancer on the nose is important for early detection and treatment. BCC often presents as a pearly or waxy bump or a flat, flesh-colored, or brown scar-like lesion. SCC may appear as a firm, red nodule, a flat lesion with a scaly, crusted surface, or a sore that doesn't heal. /r/n/r/n These signs shouldn't be ignored because prompt treatment can improve its effectiveness. If you notice any persistent or unusual changes in the skin on your nose, notify a healthcare provider. /r/n/r/n Reconstruction after Mohs surgery is often recommended for people whose cancer has required significant loss of the skin and tissue on the nose or has caused some disfigurement. It may also be required if there are any changes that may affect the function of the nose. /r/n/r/n The goal of reconstructive surgery is to ensure optimal function and aesthetics of the nose. If reconstruction is required, you will have a consultation with a plastic surgeon. /r/n/r/n Before undergoing Mohs surgery on the nose, you should ensure that your healthcare provider is well trained to perform the Mohs procedure. A detailed examination of the area will likely take place, and the surgeon will provide a plan for the procedure. /r/n/r/n You'll receive detailed instructions for your procedure, which will include anything you need to do or avoid before surgery. Things you may need to avoid are blood-thinning medications and tobacco. /r/n/r/n The surgery usually proceeds under local anesthesia, which will allow the person to be awake but the area numbed during the procedure. The surgeon will remove the visible tumor and surrounding tissue and examine them under the microscope to check for cancer cells. /r/n/r/n. They repeat the process layer by layer until no cancer cells are seen at the edges. Each layer examination can take some time, so prepare for a potentially lengthy surgery. /r/n/r/n. After Mohs surgery on the nose, follow all of your surgeon's postoperative instructions. This will help promote healing and minimize scarring. /r/n/r/n. There may be swelling, redness or discoloration, and tenderness around the surgical site, which typically improves within a few days. /r/n/r/n. Depending on the wound's size and location, it may heal naturally, be closed with stitches, or be covered with a skin graft. /r/n/r/n. Healing time varies but generally takes a few weeks. During this time, people should follow their surgeon's instructions closely. This includes keeping the area clean and dry, changing dressings as instructed, and avoiding strenuous activities that could strain the healing site. /r/n/r/n. Scarring is likely but often fades significantly over time. Prescribed ointments and protecting the area from sun exposure can help improve the appearance of scars. Keep all follow-up appointments with your surgeon to ensure healing is going as expected and no signs of infection are present. /r/n/r/n. Mohs surgery has a high cure rate for skin cancer, so the long-term outlook is typically very good. Most people have their cancer successfully removed, and it doesn't return because all cancer cells have been removed. /r/n/r/n. Though some scarring is likely to occur, it becomes less noticeable over time. Long-term, patients should continue regular follow-ups with their dermatologist to monitor for any signs of recurrence and practice strict sun protection to prevent future skin cancers. /r/n/r/n. For some, seeing a plastic surgeon may be recommended. A plastic surgeon can address any defects or changes through specialized surgical techniques. /r/n/r/n. The surgeon will evaluate the extent of the tissue loss and recommend any additional surgical procedures, such as skin grafts or flaps, to help cover the tissue loss from the Mohs surgery. A plastic surgeon helps people have a nose that functions well and looks natural after surgery. /r/n/r/n. Skin cancer commonly affects the nose. Mohs surgery is a common treatment for these cancers. This procedure involves removing the cancer as well as some of the healthy tissue around it layer by layer until all cancer is removed. /r/n/r/n. With Mohs, as much healthy tissue as possible is removed to limit any changes or deformities to the nose. If a lot of tissue needs to be removed, a plastic surgeon may reconstruct it using skin grafts or flaps. Proper follow-up care is important to help healing and minimize scarring. /r/n/r/n. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.